Good evening, everyone. I think we're going to get started. It's now 11:30. My name is Jessica Gorham, and I'm the Regional Emergency GBV Advisor for the Gender-Based Violence Area of Responsibility. And I will be co-facilitating today's webinar with my colleague from the Asia Pacific region, Leah Ashley. And I'm happy to be joined today by also Pamela Godoy and Alexina Russeri, who will also be monitoring the chat function. As in past webinars, we please encourage you to keep your microphones on mute. If you could please also write down any questions or comments in the chat box. We will address questions at the end. And Pam and Alexina throughout the webinar will be monitoring and moderating, along with Sarah Martin, who is one of our moderators for the Community of Practice. And I'm sure also we have some of our help desk colleagues also monitoring the chat. And so if we can answer your questions immediately, we'll post resources. If not, we'll come back to it at the end. As in the past, all recordings of this webinar and other resources in which we reference can be found on our website at gbvaor.net. So today's webinar, we're going to be looking at resource mobilization for GBV programming and coordination during this COVID-19 pandemic. We will have the same webinar in French this afternoon at 15:30 East African time, and that would be 14:30 Central Time. And just a reminder, next week's webinar will focus on GBV case management, particularly remote case management. And if you have any questions throughout the discussion and you don't think they've been answered adequately, then please do contact your advisor or specialist in the region. And you can find our contact details at gbvaor.net about us. So it's great to see so many people on the line from all over the world. And I hope we have a great discussion today. The outline of today's webinar, we're going to have a donor dialogue to start, an informal conversation with Kate Latimer, who is the Humanitarian Advisor for Women and Girls in Emergencies for DFID. And then we also have, as part of that discussion, Barbara Weierman, who is the Gender and SGBV Advisor for the Swiss Agency for Development and Cooperation. So we'll start with conversations with our two guests. We will then have Leah Ashley take over. She will then present guidance related to GBV life-saving criteria and activities in the COVID-19 response. The idea is we wanted to present some practical ways that you could revise proposals or other briefing notes to reflect the COVID-19 pandemic or context. And then lastly, as usual, we'll have a few minutes left for questions. But as you know, we like to keep this to 1 hour, and then we will try and come back if possible. So again, thank you all for joining. I first wanted to start off today with giving a brief overview of the global HRP, which is the Global Humanitarian Response Plan, because this has been sort of the framework, or it's been relayed to us that the global HRP is really the framework that many donors and also HCTs, humanitarian country teams, and to some extent, UN country teams, so more development focused, will use for resource mobilization. And so if you haven't seen this document, it is in our reference page. It's recommended that you do, because it also gives you sort of a roadmap for coordination and some of the expectations for protection as well. So the global HRP prioritizes countries with an ongoing humanitarian response. And the way that's defined is countries that already have existing HRPs or humanitarian response plans or refugee response plans. They specifically denote Venezuela and some other countries. And it also includes criteria for inclusion of additional countries if it's needed. And some of those that they cite who might be additional countries or second tier countries would be places like Kenya, Mozambique, Zimbabwe from my region, and then of course there are others around the world as well. This global HRP aggregates or puts together relevant COVID-19 appeals and inputs from big agencies such as WFP, WHO, UNFPA, UN Habitat, UNICEF, and NGOs. And the global HRP stipulates that they feel the financing requirements at this stage. It's also noted that this could change pending the outcome of the virus or the spread, to approximately $2 billion. And the expectation is that HRPs at country level will be revised to reflect this global framework. So the global HRP outlines how prevention and response measures are to be coordinated and implemented in countries within or with existing humanitarian response plans and operations. And I'm sure in the chat, many of you could tell us if you're in the process now of revising your current HRPs. So again, the global HRP is a framework. The expectation is you would use this framework to then revise your country level HRPs. So we thought it would be interesting to have a conversation with a couple of our key donors to understand how they are operating in this time, because I know all of us have new ways of working. So I'm very happy to have Kate and Barbara on the line. Good morning, Kate. Can you hear me? Or Barbara?
Yes, good morning.
Good morning, Barbara. And how about Kate from DFID? I know she had checked in that she was here. Maybe Shiva, you could help us find Kate in the participant list to make sure that she's with us. Barbara, maybe we can start with you, just to give us an idea about how has COVID-19 impacted your overall operations?
Yes, thank you, Jessica. Of course, it has impacted us very much. We had to first, look at duty of care so that everybody was safe. Everybody's working from home. That had to be, established. It was initially quite a challenge. But what is very, I think, important to say is that our Swiss staff from our field office is still there. So only those who had conditions were allowed to come back. Everybody else is still in the embassies and in the STC offices. So from that point of view, that I think is a very strong, because I hear from my colleagues that sometimes almost everybody else has left. And so I think it's good that our people are still there. Right now, they are, everybody is trying to adjust to the situation. And now that the duty of care is sort of organized, it's now very much about how do we reprogram. I leave it at this for the time being.
Okay, thank you, Barbara. And you did bring up a good point, just to remind us that not only are we all repositioning ourselves and looking at new ways of working, but also donors are also scrambling to ensure that they're meeting the duty of care, but then also recognizing the work that has to be done. Kate, I think you're back on the line. How has, just a very simple, how has COVID-19 impacted your overall operations?
Hi, thanks, Jessica. Can you hear me okay?
We can hear you very well.
Great. So I think there's two parts to this question. Firstly, the impact of COVID-19 on our program delivery as GBViE, but then its impact on the context in which we're working. And as Barbara says, GBViE, like all organizations and donors, is working really hard to ensure business continuity in the varied and often challenging context where we work. We've had to increase, like everyone, the use of teleconferencing, both internally and externally, and obviously that comes with its challenges, and also adapt to remote ways of working and distance support. Where possible, our country staff have remained, but yeah, it really depends on the context. And then context-wise, COVID-19 is not only an operational challenge, but is fundamentally changing the context in which we program. And GBViE is moving to a whole of organization approach to flex and adapt its programs and to ensure continuity of essential programs while still thinking strategically about COVID-specific scale-up and response. I think in terms of our GBV operations, we are engaging and supporting country offices such as GBV Malawi, Nepal, Ghana, to adapt their GBV programming in the face of this pandemic. For example, by scaling up response services and working with specialist services to ensure government guidance on social distancing and self-isolation that includes safeguarding advice. We're also drawing on GBV's WARG Help Desk, the Violence Against Women and Girls Help Desk, and that's run by Social Development Direct. And we're using this to provide technical expertise for the whole of the UK government, but also GBV's policy teams, country offices, and our international partners on mitigating actions to reduce the risk of violence against women and girls. But of course, there is a concern that programs may be paused or scaled back as staff are prevented from travelling, or where violence against women and girls might be seen as a secondary priority. And we're working really hard to understand alternative options with country colleagues, and obviously doing a lot of internal lobbying to ensure that violence against women and girls is seen as a really a priority secondary impact of COVID-19. And I think, if I may, I just have a question to the wider GBV AoR. It would be great to hear how COVID-19 is impacting your organisations and how we as GBViE and how we as donors can support you better. So if there is time, it would be great to hear sort of experiences and current challenges.
Great, thank you, Kate. And if some of our members want to answer that question in the chat, we'll have Pam and Alexina moderating, and we can come back maybe at the end and give some highlights or examples. Barbara, I think Kate just gave us a little bit of an overview, but perhaps we can also understand from SDC's side. This is rightfully a health-focused appeal, but how are donors positioning protection so that the most vulnerable will not be made more vulnerable due to the spread of the virus?
Yes, SDC is very much concerned about this effects of COVID, and it has on the vulnerable population. So we have strongly communicated to our field offices on, we have sent out gender alerts, information about the gendered impact of the COVID crisis, and we are very much strongly lobbying that GBV is at the top of their concern. We work very decentralized. So basically, our offices will, decide, dependent on the situation in their country, what they will propose for funding or how to reprogram. It is very clear that many of the humanitarian programs have to continue as they're life-saving and essential. And we are very much, we have many people who have, experience with previous health crises such as Ebola and know what it means if you only focus on health and WASH response. So I think there is a high understanding, a good understanding that you have to keep focusing also on protection. We are very much trying to encourage offices to continue investing in GBV, those who already do have GBV interventions. We are organizing webinars for every region to support them in supporting their partners in reprogramming. We have very clearly, I mean, we have already put more money into some of the GBV programs.
Great. Thank you, Barbara. That's very helpful. And something that I heard very distinctly was many of these are still country-based operations. So it would be your focal points at country level who will be sort of maybe guiding our GBV colleagues if there is revisions or also opportunities for funding. Good. Any other thoughts, Kate, from you on that second one? I know you kind of gave us an overview in the beginning, but I think this is one of the questions that our members were most interested in. Any other follow-up thoughts?
Yeah, sure. So DFID is obviously deeply concerned about the significant gender and protection impacts of this crisis. And we're engaging across governments and internationally to push for greater explicit consideration of and support to women and girls across the COVID-19 response. Our ministers have been really clear that they expect to see this articulated in all DFID's humanitarian funding. So we're making sure that this is a priority across all of our funding on COVID-19. And then I think similarly to Barbara and the SDC, DFID is very decentralized, and as such we are providing detailed guidance to our DFID country offices on the importance of embedding gender and protection into the government's response to COVID-19, as well as providing them with extra support by surging in social development advisors who are experts on protection and gender to help provide that additional technical expertise. As I mentioned before, we're flexing existing programs to ensure the needs and priorities of women and girls, people with disabilities, and specific vulnerable groups in the crisis response are met in DFID's overall response. When we're talking with our civil society partners, we are telling them that we expect to see gender equality and gender-based violence clearly brought out and addressed in all of their funding proposals. And we want to see our partners use their influence to advocate for women and women's rights organizations to meaningfully participate in the humanitarian coordination and decision-making. But we also want to know what CSOs are learning from their networks with Southern women's rights organizations about the challenges and how DFID can best support and what we should be prioritizing. And I think just finally to note that DFID's humanitarian funding guidelines were adapted last year to ensure that violence against women and girls is considered across all of our humanitarian response programming. And so we expect all our humanitarian partners to mainstream gender and protection within their operations, mitigate the risks of violence against women and girls, and utilize available guidance and tools, including the IASC guidelines for GBV and also the gender and age marker. And we expect to see this demonstrated not only in the proposal stage, but when we're monitoring and evaluating those programs. And then lastly, I think just to say that this is the first time that safeguarding measures to protect vulnerable groups have been put to the test globally. And we expect all our partners, including INGOs, to really demonstrate the lessons that have been learned over the past few years. And that's all, thank you.
Great, thank you, Kate. I heard some really great points there about women's and women's rights organization. And Barbara, I'm going to come back to you on localization on our last question, and then also safeguarding. And I was happy to hear from both that even if we know it is and rightfully so, a health-focused appeal, but that even for our health colleagues, the expectation would be that they are still mainstreaming and safeguarding in their sort of revised program for COVID-19. Is that, I hope that's what I was hearing as well, because sometimes on the onset of emergency, we sometimes forget the very real need to mainstream and mitigate risks, even in an appeal for specific to COVID-19. So thank you. Our next question, I think we're really, as you know, this epidemic or pandemic has really opened up our ways of working, but also who we work with. We have many countries now that we we haven't worked with, to be honest, you know, in depth in the past. Countries like Tanzania or Timor-Leste and others. And I think the next two questions kind of go hand in hand. But the first one is, how will donors be balancing individual appeals versus pooled funds? Because I know many countries are looking at this from a holistic COVID, you know, health response, but I'm wondering if the intention is to have individual appeals as well, because we already know that there are definitely some pooled appeals going on, but just your insights, and I know they're specific to your organizations, but maybe you can give us a little insight on that, and then also on our second one we'll go on. Barbara?
We are contributing to country-based pooled funds. For example, to the Somalia Humanitarian Fund and to the Ethiopian Humanitarian Fund. I mean, these are just two examples, the Yemen-based country-based pooled fund. And there, of course, it is important because their grants are reaching local actors, like 47% in the case of the Somalian Humanitarian Fund. So Switzerland is always advocating, you know, to put centrality of protection, gender, and localization as a very important, you know, principle of these funds. The localization, the local actors, I think, will be extremely important in this crisis. And we are, you know, have always been emphasizing that, and it will be a test this time also, whether that's actually happening more, and how we can support that. Jessica, did I answer your question?
You did. And I just also wanted to highlight, Barbara, that SDC has been great. I know you mentioned Somalia and other places about even funding, when we talk about the localization agenda, how you do give out small pockets of money for very community-based and local organizations. So we're looking forward to seeing how that can manifest during the response as well. Kate, any thoughts on individual versus pooled funds?
Yeah, so I think the financing landscape for COVID response is really complex and differs using a range of different financial instruments. Unfortunately, we're still in the process of finalizing some of our funding decisions, so I'm sorry that I won't be able to go into too much detail about this today. But we have made significant contributions to the first round of multilateral appeals, including the WHO Strategic Response Plan and individual appeals, including UNICEF and Red Cross. And I expect that that will include other agencies moving forward as well. But we also, as Barbara says, fund country-based pooled funds, which are able to provide some funding to local and national organizations. And at a country level, different country teams are responding to individual requests for support at a country level to contain the virus, delay its spread, but also working to mitigate the secondary impact. We, as DFID, have also invested in global public goods, so over 300 million for vaccine development and innovative partnerships with private sector for infection prevention and control. But we're also exploring other opportunities, such as supporting the UN Trust Fund to end violence against women and girls, the COVID-19 special funding window, which will help provide support to survivors in the context of the pandemic, and additional core funding to existing grantees, particularly women's rights organizations, to adapt to the new challenges.
Great, thank you, Kate. Lots of good information in there, and I like how you keep bringing the discussion back to those women-led and women's rights organizations, because those are so often community-based and national or even subnational. So thank you for that reminder, because I know we have people on joining us today that are representing those organizations, and it's good to hear that they are forefront in the response. How about our next question? How do humanitarian donors plan to work in countries that don't have established humanitarian coordination systems? And this, as I said, we've been, even for ourselves, it's a bit of a new way of working. We've been getting a lot of feedback from countries that don't have humanitarian response plans, but are now in the midst of a crisis and don't kind of fit into the cluster system framework. And so we were wondering if this has been on the radar of donors at all. Again, and maybe I'll throw it back to you, Barbara. Has there been any discussions about how to engage in countries that we wouldn't normally be engaging in, but because of the breadth of the pandemic that really everyone now is not immune to it, I guess? Places like Timor-Leste or Pakistan or Senegal. In my region, places like Tanzania, who might have a bit of a refugee response, but don't necessarily fit into a humanitarian box otherwise. Barbara, any thoughts?
Yes, for the time being, we are concentrating on the countries where SDC works, which is, of course, on the one hand, humanitarian, on the other hand, development, like Tanzania is for us development, more a development-oriented field operation. And there, of course, what we are trying to do is to, all these offices are now reprogramming development funds that they know will not be able to be, that continue these programs for a while, and they're reprogramming, where they very strongly work with the governments, but also work with their partners. And in many of these countries, we already do work, for example, with on GBV, to give you, for example, and on reproductive health, and that will be increased. And for example, to just mention Nepal, which is also a development context, but they are now activating the cluster system, and SDC, which has a big UNFPA, supporting a big GBV UNFPA program, is now going to support, for example, the cluster system, the working group, the GBV working group there.
Okay, great, thank you, Barbara. Kate, any insights or thoughts from your side?
I think both WHO and the humanitarian system are promoting a whole of government, whole of society approach. So DFID's response will be bigger than the humanitarian system alone. I think coordination is obviously always important, but it will depend on the context, as you say. So Pakistan, for example, is scaling up its UN presence, but the response will be coordinated by its National Disaster Management Agency. So for DFID, government, wherever possible, retains that vital role for managing and coordinating the COVID response. And where we can, we'll be supporting those humanitarian coordination systems as we always do.
Great, so thank you. So just to sort of summarize, it sounds like what I'm hearing is that the development funds are being reprogrammed in many ways to meet the needs of the pandemic. That we're very much supporting the government as coordination leads. And then similar to the HRP, it sounds like Barbara gave an example of Nepal, that if countries are themselves declaring a higher level of an emergency, then the UN would then respond, and donors as well, accordingly. And so those are also helpful highlights. And for our last question, and I know we've been getting bits and pieces of answers throughout the other four questions, and I'm happy that SDC, who I think is also on the Global Localization Task Force, are donors thinking differently about localization, particularly since most international staff now are working remotely, and that puts the onus, really, or it puts the majority of responsibility on our local and national, subnational counterparts. Has there been discussions around that? How about Kate, I'll start with you.
Great, yeah, this is definitely something that's been currently discussed internally, noting the increasing need for remote working with our partners, and then also the reliance on local and national organisations. We recognise that national and local society have such a critical role to play, particularly in reaching marginalised populations and where others experience difficulties in access. as I've been saying sort of throughout this webinar, local and national civil society is a real vital partner for DFID, and we're really committed to working in partnership with CSOs to meet the challenge of responding to COVID-19. We know that in many places around the world, civil society will be best placed to respond to the developing crisis, as I say. So we've been in regular contact with our CSO partners to better understand how they can help us respond, as well as the strategic challenges that COVID-19 pose to their own resilience. So DFID's approach, in line with the UK government's overall approach, is to work collaboratively with our partners to find flexible solutions that maintain delivery of essential programmes as far as possible. And we'll be providing detail on that shortly. It's something that's currently in development. But I guess just finally to note that DFID has continued to support women's rights organisations through our funding to the UN Trust Fund to end violence against women and girls. And that's been 21 million over the last 7 years. And as I mentioned, we're looking at opportunities to support their special funding window on COVID-19. But we're also currently exploring different modalities to fund women's rights organisations. And we've been in discussions with a number of different partners on what that could look like, and hopefully we'll have something to share with the wider community in the coming months.
Great, thank you, Kate. It's so good to, again, I love your emphasis on our women's rights organizations, human rights and local organizations. And I know that DFID has also been a strong advocate for our call to action as well. So, and I think in some of the countries on the line, call to action has been a guiding framework for their GBV prevention and response programming. So thank you so much. And then lastly, Barbara, did you have anything additionally to add about localization?
Well, you know, for us, localization is a very important agenda, always have been, and recently, especially and also in the last years, we have also supported the appeal by IFRC because of this, because we know how important the national societies are in these emergencies. And we believe that it's a test now for local actors as well as for donors, whether they can really adjust the requirements. And we are certainly pushing this and trying to continue, you know, working on how to make it easier to fund and to engage with local actors. But as we have said before, for us, it's a big agenda, and we're throughout have been trying to, you know, engage with local actors and support local actors, local civil society organizations.
Great, thank you, Barbara. And I'm glad that you brought up the Red Cross, because we've been referencing a lot of the materials that they've developed, which are quite up to date over our past webinars. And we've also highlighted and promoted the use of Red Cross volunteers, or engaging and making sure they're part of our coordination mechanisms, because sometimes they are the last sort of frontier in terms of community engagement and other things. So thank you for reinforcing that message. I just wanted to come back to a couple sort of highlights, and I think you provided a lot of great information, which I know all of our members really appreciate, and we do recognize this is the beginning, and that not everything is finalized, and it's a work in progress as much as it for us as well. So some of those things, again, Kate, I could repeat this and have it probably tattooed on my forehead. This real focus, and I hope you'll help advocate for us at the highest level, the need to make sure that women-led organizations, national, subnational level, local organizations are really at the forefront of this response. And I think last week, Pam, you had mentioned that 70% of our healthcare workers are female. So not only on the GBV side of programming, but also how we look at mainstreaming GBV into the health cluster. 70% of our healthcare workers are women, and there's still, we won't even go into the inequalities of pay, but just the exposure and the risks that they are taking on a daily basis. So that's very, again, very much appreciated. And then also we appreciate as well the focus on looking at how you can translate or transition development funds into humanitarian funds in those countries that we don't have our normal ways of working because they're more development focused. And just lastly, I wanted to just remind everybody, especially our members, that the HRPs are being revised at country level throughout April. And I shouldn't say throughout April. I'm sure many of you have gotten notices or a request for feedback. This is our time really to make sure that GBV is mainstreamed and continues to be mainstreamed throughout our humanitarian response plans at country level. So this is a critical time for us to make sure that our advocacy points are out there, our key messages, and that programming, GBV response and prevention programming, is considered essential, not only within the humanitarian system, but also within governments as well. So I will, and I also wanted to note that I think we do have a BPRM colleague on the line from a country level colleague, and we just wanted to acknowledge we appreciate you joining the discussion today, or listening to the discussion, because you are a great supporter, as well as DFID and SDC, to the GBV AoR overall, but then also to our partners working at country level. So we appreciate you listening in today. Thank you both to Kate and Barbara. It's very much appreciated to have you on the line for this chat. And I know, Kate, you had mentioned having examples of different ways of working, and I know that Pam is getting some of those examples. And at the end of the discussion, and in probably about 15 minutes, we'll come back to Pam so she can give us some of those examples, because I think we're all really interested in learning from each other as well. So thank you again, Barbara and Kate, and we'll come back at the end with some answers to that question specifically. Right now, I want to turn it over to Leah Ashley, my colleague from the Asia Pacific region, who is the regional advisor there, and she's going to take us through some of the guidance that we've developed at the AoR to help our members to navigate sometimes this complex issue of funding. Leah Ashley, I'm going to turn it over to you.
Thank you so much, Jessica, and thank you to our panel of donors. Are you able to hear me?
You're coming through loud and clear, Leah Ashley.
Great, thanks. So first, we want to make sure that all of our participants today have access to the recently released key messages from the Interagency Standing Committee on flexible funding, and that's specifically in relation to the COVID-19 crisis. These messages appeal for continued funding to humanitarian response plans, flexible funding for reprogramming of pre-existing funds, and simplified fast-track procedures. So we recommend that everyone review and refer to these messages in your forthcoming resource mobilization efforts. But now we want to turn to thinking about what frameworks we can use to determine which activities should be prioritized. When you're reprogramming funding or applying for new funds, what advocacy and resources can you use? For GBV coordinators, we've been talking about the HRP today. You may need to participate in HRP defense processes. So what are the key frameworks that you can use to make the case for the criticality of GBV interventions? So I just want to preface by saying there's no one right answer to these questions that I've raised. We'd like to hear from you more in the chat especially. But first, we're just going to revisit some of our two key concepts for GBV programming and coordination funding that are extremely relevant now. You've already referenced them in the chat and in our previous conversation, and those are life-saving and essential services. Next, okay, you're there. So life-saving criteria can be defined in different ways by various donors and funding mechanisms, but they include components of both GBV risk mitigation across different sectors and specialized GBV response, as we've heard today from our donors. So humanitarian actors may be most familiar with the SURF life-saving criteria as one example of this kind of framework. Advocacy has already been successful in ensuring that the Global Humanitarian Response Plan and the SURF funding appeals for COVID-19 have GBV interventions listed as essential For example, the global HRP mentions GBV 17 times, and I think this is an achievement. In contexts where there is active interplay with development programming, costed essential service packages for GBV may be a more commonly used framework. And these essential service packages ensure a multi-sector response to GBV, including health, social services, police, and justice, as well as livelihood in some cases. For COVID-19 this week, the UN Secretary General called for a domestic violence ceasefire. And he made a specific appeal that governments include GBV services as part of the COVID-19 response plans. He used the language of essential services to refer to GBV interventions. If you could just show the next slide, please. And I think we're inserting into the chat also the video. This is a really key item that you can use in your advocacy going forward. So last week in your post-webinar survey, you told us that you wanted more examples from the field. So on the next slide, we're just going to show you a few examples that fall within this framework of life-saving and essential, responding to GBV that we're getting reports of now. So for example, in Fiji, in an access to justice project funded by EU and supported by UNDP, they have now transitioned and they're integrating COVID-19 information service provision with GBV referral services using hotlines and strengthening the hotline system. In Kosovo, UNFPA and UNDP are strengthening support to safe shelters for women and children to ensure the continuity of life-saving GBV services. Here, they're delivering food and other essential hygiene supplies. In Timor-Leste, civil society, including local organizations like PRODET and UN Women, are ensuring that GBV referral pathways are revised quickly, and they're disseminating them using social media. Next slide, please. These are just a few examples, but they're emerging examples every day from the field. I really appreciate the examples that you're sharing in the chat box and that our donors have shared as well. We're really in a context where all GBV programs are rapidly innovating to continue to provide services. So in the blue boxes, we've listed some of the types of activities that we're hearing are continuing and being supported in different contexts. I'll just give a few examples, but this is something again to respond to in the chat. If you have different examples of life-saving or essential services that you've been successful, or also challenges that you're facing in convincing others that these services are essential. So for example, we've heard in Indonesia, they're in the process of revising SOPs for COVID-19 and conducting advocacy with the government. As mentioned before, in Fiji Pacific, they're engaging in training frontline healthcare workers and civil society organizations on referrals. We've heard examples from the Philippines of adapting women-friendly spaces, either moving them to new locations that are more accessible, or also putting in the safeguarding measures that were discussed earlier and changing how we work with information points. So these are just a few examples. I'll give you a moment to look through the chart and respond in the chat room if you have others that you would like to share or if you have questions. Okay, next slide, please. This is just also a reminder that life-saving criteria include life-saving activities across different sectors, not only GBV specialized services. Next slide, please. I think actually if we could go back to one slide on our surf indicators?
I don't, sorry, Leah, Ashley, I don't know why it's not in my, let me try and, or Shiva, can you quickly put up the other, with, that one is a key slide.
Yeah, I will open.
Thank you.
So that
And
gives
maybe,
us, go ahead.
no, you go ahead, Leah, Ashley.
That gives us time to chat.
Excuse me.
Yes, we're, Pam, maybe you can give us some of those examples while Shiva's putting up that one critical slide. If you can maybe give us some examples that of good and best practice.
Jessica, this is Pamela. Thank you. What we're monitoring right now are comments related to the interventions coming from our resource persons. So GBV coordinators and specialists are sharing about their struggles to find funds to help them adapt their programs from static service delivery to remote service delivery amid not just for the COVID-19 related lockdown measures, but also existing high security risks in their country context. And then some colleagues are also sharing about their country level donor briefings that they're conducting and organizing to engage donors with regards to how to adapt and reprogram ongoing interventions to be able to respond to COVID-19. And they said that donor partners are emphasizing the need for regular updates and ensuring a coordinated approach given the existing clusters and partnership mechanisms in the countries. There's also a comment related to women-led organizations and how historically it has been challenging for them to get funding directly from the big traditional donors unless they form a consortium or become implementing partners of INGOs or UN agencies. And then there are also comments relating to how donors can ensure accountability with regards to gender GBV analysis as well as GBV integration as key funding criteria. So over to you, Lee Ashley or Jessica.
Excuse me. Hello?
Hi.
Hi. Sorry.
Yep. We're requesting if you have a question, but please go ahead. But for others, we're gonna try and put them in the chat.
Okay. So shall I write in? Okay.
No, you can, yeah, you're on the line. Go ahead.
Okay, apology to interrupt you. Regarding the other, the essential services PowerPoint, I just have a question. How does it work, the remote case management? If you can have more information, more guidance on this. Thank you.
Yes.
Okay.
That's a great question, and one that we're going to answer in depth next week, which is the focus of our webinar next week, is just that, remote case management, which will be facilitated by Pam and our other colleague Alexina. So that's gonna make you want to dial in for next week's presentation, which will be exactly on remote case management, but a really great question.
Okay, no, thank you. Okay, thank you.
Okay. And I think we're just about, I see the presentation. Great.
Okay, thank you for your patience. So before we end, we just wanted to share some examples, because many of you may be engaged in working on proposals, of life-saving activity areas. So these primarily come from SURF life-saving criteria, but SURF aren't the only life-saving criteria. And then what are some key activities and indicators? These aren't the only indicators or definitive guidance, but these are suggestions for us to think about as a community and also to have dialogue about with our donors. So I'm just going to highlight a few that also are relevant to the chat. In the second area there, ensuring relevant supplies and a range of appropriate psychosocial support interventions are in place and accessible is an area of life-saving GBV intervention, as defined across many different funding mechanisms, including SURF. In the context of COVID-19, this area of work is an extremely high priority. So some possible activity and indicators include ensuring that frontline health workers are provided with relevant training and communication materials to make referrals, and those could be measured in numbers. Or in contexts where community-based organizations or case managers will provide these remote services, the focus may be on the numbers of organizations that are appropriately equipped and trained to provide these services in line with minimum standards. It's also important to continue to ensure that sexual and reproductive health services are promoted as essential, and we have indicators to ensure that survivors of sexual violence receive timely life-saving care. And this is a pre-existing indicator that can also be used in this response to ensure that sexual violence survivors receive clinical care within 72 hours. So these are output indicators. We can probably chat in the questions about outcome indicators among others, but we thought it was important to share this guidance to begin to think about how we define our outputs and our outcomes and what we're going to achieve in concrete ways with this response. So I think now it's back over to you, Pamela and Alexina, for further questions and discussions.
Thank you, Jessica and Lee Ashley. Alexina, do you want to ask the questions now? Okay, I think Alexina is not connected at this stage. There's a question relating to disability inclusion in the response to COVID-19. So how intentional are responses with regards to addressing the specific vulnerabilities of women and girls with disabilities? And then Lee Ashley, as you have mentioned, what kind of outcome indicators do donors recommend at this stage? Because most of the ones that we have outlined so far are output indicators. Perhaps the resource persons can answer those two questions first, and then we'll revert if there's more time for additional questions. Thank you.
Barbara or Kate, would you like to engage with any of those questions regarding visibility or outcome indicators?
Hi, on the disability question, I think just to emphasize that our humanitarian funding guidelines ask all our humanitarian partners to mainstream gender, but also disability within their operations. And we expect all our partners to be using available guidance and tools in order and demonstrate that they're using those in their programs. It's very much a priority issue for DFID, and this is something that we want to see come through clearly in terms of the COVID-19 programming.
Thank you, Kate. Are there any further responses to those questions?
Or maybe we can also add one more question. I don't know if this was asked earlier because I was disconnected. Can I?
Yes, Alexina, we have time.
Okay, if we have time, I think we are now looking at the outcome indicators that donors would recommend. Do we have outcome indicators that donors would recommend, especially in the in different proposals with regard to COVID? And the other question coming from Syria, they are also concerned that they are receiving some concerns from the GBV actors that some of the donors are deprioritizing GBV activities that are not life-saving, like case management. But of course, we know that it's also part. How can we really distinguish between what we really mean, call or consider as life-saving? Because most of the activities you hear when it comes to GBV, actors have to find an entry point.
Thank you, Alexina. Would either of our donors like to respond to those?
Well, I think I'm hearing this, that they are trying to deprioritize GBV in Syria, and I will take this up also with our Syria, people responsible for Syria response. So thank you for this information. Actually, we are not. This is not our policy to prioritize GBV. Wherever GBV is already an operation, it will continue or it will be even increased. Where we do not at the moment have any GBV, activities or interventions, I think at this moment it will take time, to invest in a new program. I think I'll leave it at that.
Thank you, Barbara. Kate, would you like to respond?
Yeah, I think on the deprioritization of GBV within certain country contexts, that is definitely sort of something that we're aware of, and we're working sort of internally to ensure that that isn't happening, and we're making sure that DFID staff are aware that GBV is a priority in terms of the secondary impacts of COVID, the impact of COVID-19 will have on case management, on accessibility to GBV services. And as I said earlier, we're producing a lot of guidance around that and sharing it with our country officers to make them aware that this is something that we should continue to be prioritizing. And certainly within new funding for COVID-19 response, that will remain a priority and will be included in sort of call for proposals moving forward.
Excellent, thank you, Kate. That is why we shared some of the materials today with you regarding life-saving criteria, and I would encourage everyone to revisit those criteria. There's an annex in the GBV Coordination Handbook, and then also we have resources listed that we'll share again when we share this PowerPoint in the community of practice. So we can all send the same messages about the need for GBV, including case management, to be considered life-saving. So we are almost out of time, so I will bring us to a close, and I'd like to remind everyone to participate in the post-webinar series. It's going to be posted now in the chat box as well as in the community of practice. Please also be sure to join us for next week's webinar. We'll be here at the same time, same place, and I'm pleased to say we'll be discussing case management, which again came up today in our questions and discussions. Finally, I'd like to say a big thank you to the GBV AoR community of practice and the help desk. The GBV AoR website will also continue to post updates and events. Please stay informed, exchange best practices with peers, and receive the latest guidance using these formats. So I want to thank you all who have joined us today. I do apologize for our tech delays, but appreciate your patience. And we very much look forward to seeing you next week. Please do stay safe, stay well, and continue to save lives. Thank you.
Thank you, Lynn.